Cavities are something that we deal with on a daily basis. And there are smaller cavities that show up on x-rays. There's cavities that we find during our examination that are very small. But we also deal with big cavities. The smaller cavities a lot of times can be done very quickly. We typically will use local anesthetic to numb the mouth, but when we get to the bigger cavities that are very deep, then we need to look at, is a cavity, a filling going to be enough to take care of this cavity? Sometimes we have to crown the tooth. Sometimes if it's very deep, we actually need to do a root canal on that tooth, and that's where the decay gets down into the nerve of the tooth, and once it's down there, it begins to kill that nerve and cause infection, and that's why we end up doing root canals. Occasionally the cavity is so big that the tooth is not fixable, and so in those instances we have to take out the teeth and then talk about replacements for those teeth after they heal. Whether it's a bridge, whether it's an implant, or whether it's some type of partial denture to fill those space again so that they can maintain their chewing and the structure of their mouth the way it is right now. So when we talk about individual teeth, removing those, a lot of times I'm dealing with 1 or 2 teeth and they're very localized and we're able to get those out. But when we start talking about wisdom teeth, we talk about 4 of them and getting all 4 of them done at one time. Wisdom teeth are something that we all had to deal with. Another word for wisdom teeth would be third molars. And when we begin to start looking at these, usually the patient or you are in high school or college, and we try to determine when the best time to remove those teeth. Most of the times, there are not enough room in our mouth to accommodate wisdom teeth, so they only come in part way. And when they come in part way, they can continue to decay, they can cause some decay problems, or they can cause infection. So a lot of times we will refer wisdom teeth out to an oral surgeon or a specialist to take them out. Number one, wisdom teeth can be kind of tricky and difficult to get out, and so when we refer to an oral surgeon, we refer to somebody who takes out thousands of those and knows the best way to get them in and out. And the complications are a lot less as well. If you have any questions about this video, please call our office. We'd love to hear from you, and we will do our best to answer your question, and if necessary, make you an appointment with a doctor.